Good morning and welcome everyone to this second Alberta Medical Association Primary Care Patient Summit. It's great to see such a good turnout today, and I know today's session will be as lively and informative as the first event that we held at the Hotel Macdonald back in February in Edmonton. The first Primary Care Summit focused on looking at the experience of primary care from the patient's perspective. We learned that physicians do understand and agree with much of what patients want and are doing their best to deliver it, recognizing that limitations within the healthcare system sometimes get in the way of doctors' best intentions. On a positive note, yesterday afternoon, the physicians of Alberta voted overwhelmingly to accept a new agreement between the Alberta Medical Association and the Government of Alberta. This is a big agreement and covers a lot of ground. But for purposes of this meeting, it contains a sub-agreement focusing on primary care, specifically how we can make primary care better. That will be today's focus and a welcome discussion with input from you, our patients. Our agreement is for 7 years and provides stability and an opportunity in planning and reform. It includes the intention to create a provincial electronic medical record strategy. It also includes working to achieve system efficiencies so that we can all get better value from the dollars we spend on healthcare. You are going to hear a lot about primary care today and a lot of ideas, expectations, and suggested improvements. We have a great primary care system. It is evolving every day, but it needs to evolve. We need to move away from traditional thinking and find innovative ways to improve our system of care. New ways to use healthcare teams, new ways to provide care for patients, new ways to smooth out the bumps from moving from your family doc to your specialist care and then back to the family doc. We need to keep primary care and specialist care from running in separate silos. We need a system where the right hand knows what the left hand is doing, where the teams can communicate with each other and every patient has a medical home that you can return to after moving around in your primary care neighborhood. To help us lead this work, we need to hear from you, our patients. For example, you'll hear today about ways to strengthen the relationship between patients and family physicians, improve quality of care, continuity of care, and make the healthcare system more efficient. What might that look like from your perspective, the patient? What would you and your family think? What advice do you have for your physicians? What are the priorities that need to take place in order to support a more inclusive and comprehensive care system that works in the community you live in? There are physicians in the room today who will be sharing their ideas and experiences. I really look forward to the conversations between you, physicians, and we have the ear of government here this morning as well.